Hey everyone, welcome to my channel. Today, we're going to talk about something heavy but necessary, euthanasia. A practice that sits at the heart of many ethical, medical, and emotional debates. Let's break it down together. What is euthanasia? Euthanasia, often called mercy killing, refers to intentional ending a life to relieve pain and suffering. This usually applies to patients with terminal illnesses who experience unbearable and irreversible conditions. There are three different forms of euthanasia: the voluntary euthanasia, non-voluntary euthanasia, and involuntary euthanasia. First, the voluntary euthanasia, when a competent patient makes a conscious choice to die. The non-voluntary, when the patient is unable to decide, like in coma. And the involuntary, when it's done against the patient's wishes. This is illegal and considered murder. There are also assisted suicide, where the patient ends their own life with the help from a doctor. Countries like Switzerland, Belgium, and Canada have legalized form of euthanasia under strict guidelines. This is where bioethics enters conversation. It is ethical to help someone die even if they're suffering. Let's consider the principles. The autonomy says patients should have the freedom to choose. The beneficents urge us to act in the best interest of the patient. The non-beneficents tell us to do no harm, but is also allowing endless suffering more harmful. Injustice reminds us to be fair. Who will get access to this option and who doesn't? There's a perspectives from religion and society. Religion and Christianity, Islam, and Judaism generally oppose euthanasia, viewing life as a sacred and only God having the right to end it. Meanwhile, secular supporters argue for compassion, dignity, and the relief of suffering. Some fear that legal euthanasia could lead to a slippery slope, where vulnerable people may be pressured into dying. So, where do we draw the line between compassion and control? It's delicate balance. Euthanasia isn't just about laws or medicine. It's about human values. Whether you agree or not, what's important is what we approach this issue with deep respect for life and empathy for those in pain. Let's look at some real-life cases that shaped the global conversation. In the Netherlands, the first country to legalize euthanasia in 2002, strict guidelines ensures it's only allowed when suffering is unbearable and untreatable. In Canada, medical assistance in dying or MAID was legalized in 2016, but recent compassion to conclude those with mental illnesses raised ethical alarms. In 2014, 29 years old Brittany Maynard, an American with terminal brain cancer, chose assisted death under Oregon Death with Dignity Act. Her case sparked international debate about individual rights and end-of-life choices. Legalizing euthanasia comes with challenges. How do we regulate consent? How do we ensure it's not misused, especially among the elderly, disabled, or mentally ill? Even in countries where euthanasia is legal, it's never taken lightly. Often multiple doctors, psychological assessments, and waiting periods are involved. But these policies are still evolving, and mistakes can have irreversible consequences. One often overlooked option is palliative care, which focuses on comfort rather than cure. Doctors also advocate for better mental health care, family involvement, and even spiritual guidance as ways to ease suffering. In the end, euthanasia isn't just a yes or no issue. It's a spectrum of hard questions that challenge us to think deeply about life and death, and a meaning of dignity. That's all. Thanks again for staying with me through this important topic. Let's keep learning, questioning, and respect each other's view. Thank you.